Gentleman yields back. I now turn to Mr. Doggett, the sponsor of the bill, for purposes of an opening statement.
Thank you very much, Mr. Chairman, for permitting consideration of this legislation, and my thanks to Mr. Johnson for his leadership on it also. So often we hear about the need to address waste, fraud, and abuse in government. This is a glaring example of where waste is occurring. And while I wish that we could take more direct action to address it this morning, this very modest bill proposes for us to get the facts to have the ability to do something about an important area of waste. Taxpayers are spending millions of dollars every year on prescription drugs that are discarded due to the size of a single-use vial or some other drug delivery system. Unused medications waste money. The very modest bill that we are offering today simply requests the Health and Human Services Secretary to investigate the inefficient use of resources and develop an action plan to reduce drug waste and spending. Senators Klobuchar and Senator Grassley have a bipartisan measure that's very similar to this that I hope they can now take the legislation we approve and actually get it written into law in support of our efforts today. In consultation with relevant agencies and committees, patient advocates, healthcare providers, and other interested parties, the Health and Human Services Secretary should develop an action plan and make some recommendations to us to reduce drug waste and better manage cost while ensuring patient access. Let me give you some specific examples of why we need to do this. A 2016 study by Memorial Sloan Kettering Cancer Center found that Medicare and private insurers are wasting, that is, they are literally throwing away about $3 billion worth of cancer drugs every year due to oversized vials. These drugs are typically discarded, wasted, not only taxpayer money, but also life-saving pharmaceuticals. Last year, the Department of Health and Human Services Inspector General found that using, quote, different vial sizes could significantly reduce discarded drugs. That's the amount of drug waste. And the Inspector General analyzed 20 single-use vial drugs and found that the Medicare Part B program alone spent $195 million on drugs that were just thrown away. There was another investigation last year concerning eye drops that are produced in oversized doses, sometimes more than twice what the eye can hold. This waste occurred across a range of eye medications, from expensive glaucoma treatments to generic drugs for just simple eye irritation. One pharmacist in that study expressed the frustration that this waste is, quote, for a drug that's literally going in the trash can. Some of them do go in the trash can. The same report talked about the amount of drugs that are literally flushed down the toilet, that are thrown away because of arbitrary expiration dates by hospitals and by individual consumers. So this is a chance to begin to do something about that. Potentially, we risk patients' health and lives when we don't deal adequately with this. Indeed, one recent lawsuit brought on behalf of the United States and 31 states, including the state of Texas, alleges that McKesson and its subsidiary U.S. Oncology sold discarded drugs which had been repackaged in non-sterile conditions, leaving them open to contamination. AmerisourceBergen pled guilty to misdemeanor criminal charges last year for similar practices and paid $900 million in fines. With such waste and abuse, far more is needed than a mere report. But at least the one small step that is directed by this legislation may raise awareness of the problem and encourage Health and Human Services to actually do something, to take meaningful action, to save the taxpayers and consumers money, and to ensure that these life-saving drugs don't simply go down the drain. I would also ask unanimous consent, Mr. Chairman, to include in the record a letter of support for this legislation from America's health insurance plans, who recognize the benefits of it, and the Inspector's General report that I referred to that was conducted last year.
Without objection.
And I yield back.